this lecture, we will explore effective ways of respectfully incorporating the narratives of patients with mental illness into your writing. We will begin with a discussion on interviewing a patient who has a mental illness, and then move on to the ways you can write from the point of view of the patient in a non-stigmatizing and accurate manner. With the evolution of modern medicine in the post-18th century modernity period, groundbreaking, quantitative, fact-based research was considered more scientific and objective. However, the scientific narrative is changing again, shifting focus to the stories about patients and their illnesses, patient narratives, and the unfolding and interwoven story between healthcare professionals and patients. Narrative provides meaning, context, perspective for the patient's predicament. It defines how, why, and what way he or she is ill. It offers, in short, a possibility of understanding which cannot be arrived at by any other means. This medical narrative framework was coined as narrative-based medicine, or NBM. NBM allows us to see the patient's mental health issue from their perspective, better understand their suffering, and study the patient's story outside the bounds of the biomedical model. NBM and science writing centers on the concept of bringing the patient as a subject back into the fold of medicine and medical writing. Including the patient's experience into medical literature is of utter importance in perpetuating authenticity, respect, and scientific knowledge. Interactions between science writers and patients lend themselves to this process of simultaneously describing something pathological and describing the life of the illness in that specific individual. Incorporating a narrative allows the subjective dimensions of medical practice and the dissemination of medical knowledge to resurface. Narrative cognition is thought to represent the default mode of human thought, proving structure to reality and serving as the underlying foundation for memory. How do we best use narrative-based medicine within an ethical framework? In thinking about incorporating such a model into science writing, we need to be wary of ethical parameters and consequences inherent of science journalism. Ethical journalism refers to the way in which writers, whose job it is to provide a truthful, comprehensive, non-maleficent report, take care to preserve the dignity of their subject and ultimately extend the social responsibility of ethical care onto society. While there is no discernibly clear line when it comes to ethics, we all have a responsibility to ourselves and each other as science journalists reporting on mental health to present the stories in a manner that is ethical and sensitive. How someone writes changes how the audience understands an issue. There are tangible ramifications, as we have seen, regarding the stigmatization of mental illness. Now, we are going to delve deeper into the actual process of how we can be better agents of mental health communication. When it comes to interviewing a patient with a mental illness, there are several skills that must be adopted in order to report ethically and ultimately successfully communicate a narrative. The patient interview provides the gateway to the health of the patient. We will discuss the basics of how to approach interviewing a patient who has a mental illness. Let's start off with an open-ended brief question that gives the patient the greatest amount of response, latitude, and agency. This will establish a positive rapport with the patient from the start. Encourage the patient to speak freely by asking him or her to tell you more about that, or offer positive non-verbal signals such as nodding or smiling. The establishment of mutual trust and understanding is the most important piece of this process. In order to do so, it is crucial to watch your patient's demeanor and respond to it, monitor your own demeanor, speak plainly and with compassion, monitor your tone so as to avoid dehumanizing the patient, follow up on material that is clearly important to the patient, and avoid thinking up the next question as you go. Here are a few rules to abide by when interviewing a patient. Avoid phrasing questions in the negative. Avoid leading questions. Avoid double questions as it leads to imprecise information. For example, have you had trouble with your sleep or appetite? Keep questions brief. Elicit quality information about feelings. Refrain from making assumptions and hasty generalizations based on formal knowledge or interactions. Consent is also a critical component of interviewing a patient and incorporating a patient's narrative according to an ethics of care. Interviewers must obtain informed consent prior to the start of intervention, ensuring that the patient has the capacity to make such a decision. When the context moves from data collection to the communication of science to non-expert audiences, stories, anecdotes, and narratives become not only more appropriate but potentially more important. Thus, we must ask ourselves how we can best incorporate the patient's narrative into science communication so as to foster this ease of comprehension and engagement. When creating a narrative, multiple layers of accuracy need to be maintained. Dahlstrom refers to these layers of accuracy as external realism and representativeness. External realism represents narrative elements that are accurate relative to the real world. In an effort to engage with the audience, a writer may use personification or a metaphor, for example, to further explain the patient's experience. In doing so, it is important to consider the implications of making such a correlation. The ultimate goal should always be to accurately describe the process in an understandable and possibly memorable manner. Representativeness refers to the manner in which the narrative may be generalized outward. Journalists should weave the patient's narrative in a way that is generalizable while also representationally accurate. Thompson and Kruter encourage writers to consider these steps in order to successfully integrate the patient's narrative. Incorporate details, elicit emotional response by using emotional content, use a natural voice, solicit feedback and revise. Pilot tests on colleagues. Journalists need to be wary of persuasion that is inherent in the field of narrative communication. Audiences often accept views within a narrative framework as normative, as the story itself demonstrates accuracy and does not need to be defended. This can potentially perpetuate misinformation and inaccuracies about the topic at hand. In order to protect against this challenge, journalists should ensure that the understood goal of their communication is for comprehension, not persuasion purposes. Studies show that even when people's beliefs are totally refuted, they fail to make appropriate revisions in those beliefs. As a rule, strong feelings about issues do not emerge from deep understanding. It is for this reason that disseminating information about mental health in a non-narrative form will not necessarily change existing stigma, as facts are not the ultimate foundation of our understanding. Our ways of thinking about mental health have become adaptive. No matter how many scientific studies we read about mental disorder discoveries, we will likely remain unmoved because we discount accurate information if our belief system risks being compromised. To close the lecture, we will discuss how to best report on or write about suicide and self harm given its pertinence. Reporting on suicide and self harm has the potential to lead to copycat behavior if it is not done in a responsible and sensitive manner. Some guidelines for reporting suicide and self harm include: focus on feelings, not behaviors, report underlying issues or motivations, don't be explicit about methods, avoid coverage of self harming behaviors by celebrities, as this has the potential to glamorize or prompt imitation behavior. Remember, the correct term is to complete suicide, not commit. Avoid phrases like unsuccessful suicide attempt. No images relating to self injury should be used. Avoid presenting the behavior as an appropriate solution to the problems, as readers may interpret the behavior as a positive coping strategy. Avoid disclosing the content of any suicide notes. These guidelines are adopted and adapted from a UK based nonprofit, Time to Change.